This is Sheryl Fisher, president of Araxis 3 Productions, giving my view on gallbladder duct stent operations. This video requires patience, but will make you aware of the complications which can occur with gallbladder stent operations as of 2023 of our years. My mother, Elizabeth Jones, passed away on November 27, 2023, my birthday. As a reminder of the needless suffering she went through after having gallbladder stent placed in her gallbladder duct. My mother was fragile to begin with, and in my opinion, should never gotten the minimally invasive surgery that they recommended. It was supposedly an in and out procedure, but it was far from the truth and a deception. I was the first one to notice she was jaundiced and was surprised that the surgery was rapidly planned. I also researched some of the prescription medicine that was prescribed her for a continued medical condition over the years that can actually result in the patient having jaundice. I was against her having the stent placed in the duct, but there were opposing forces that convened. Yes, the placing of the stent was successful, but after it, there was one nightmare after another, and the realization that it was not just an in and out surgery. After she arrived home, it was not an option to return to the doctors who prescribed the faulty medications or decided that she should have rushed surgery at her fragile age instead of trying other options to reverse the jaundice, such as oral medication. Some doctors considered that at her age, anything, even death, would be okay. To begin with, I was given a general copy by a member of the family of the procedure, which did not explain in detail many of the risks, etc., of the stent placement before the procedure was performed. It was not explained that the in and out procedure could have complications when my mother returned home. There was one thing after another. There are stories on the internet that describe people's decision not to regain the hospital due to life-threatening procedures that they initially trusted as safe to start with. One day I was surprised in a conversation that a lady related to me that a hospital told her she could receive payment by the state if she took care of her sister at home. It occurred to me that evidently patients need more care than what they are given. I don't want to prolong this and will leave it at that. As I previously stated, there was one nightmare after another. It was expected that she had effects from the anesthesia also. She was prescribed an anti-nausea drug named ondansetron, which in my belief caused her to act strangely, including not walking. Ondansetron has all kinds of side effects, including loss of balance and coordination. Directly after using ondansetron, she had issues trying to walk because she was still walking previously and later was confined to bed. Being confined to bed, she was unable to walk to the bathroom. I had to personally provide my mother's hygiene, as she had difficulty doing that herself. It was necessary to place my mother in diapers. Her difficulties additionally came from not being able to rise up properly from the bed due to abdominal pain, which she never had before, resulting from the surgery. If you cannot rise up from the bed, how can you walk? And our house had little facility other than the rails I provided next to the bed to help her stand when pain was released. let's see. The other thing was dental care, as she could not visit the dentist to get proper repair of her dentures, which would enable her to eat and survive. I realized that when I was providing 500 actions for my mother, that 500 actions were not being performed. I knew deep down, though, that the care I was giving her was more thought out, understanding, and attentive than any general hospital could give. I made sure that I gave my mother natural and organic remedies to replace the deadly prescription medicine she was taking. I performed a lot of research in addition to the care I provided. I also provided fresh juicing for her, which was a timely task, not every day, but when I could. I also found that from the intense care I was providing for my mother that I was being worn thin. Both parents are the same age, so I was also providing energy towards food preparation for both and other items, and also battling my own illness. There were a number of issues over time which I faced after she came from the hospital. She became unable to stand and walk. There were bowel complications. The bowel did not act normal for months, but I was able to get it to a formed state with the help of a trusted source and appropriate nutrients. A urinary tract infection appeared, which I was able to clear up using natural biocompatible nutrients. There was a loss of appetite, weight loss, a hearing disability, and arthritis, pain, etc. Before she went into the hospital, her feet were swelled, but I was able to get her feet back to almost perfectly normal after the stent operation by using natural products. There was also this terrible itching, but after some time of working with my mother, the itching became minimal. During her care, there were physical and emotional traumas. Her emotional state of depression was off and on, causing loss of appetite, eating smaller and smaller amounts of food, and resulting in weight loss. My mother additionally was unable to go to the dentist to get her dentures fixed properly, which were always uncomfortable. She got tired of chewing and refused her dentures at the end, with even more weight loss. She also had a hearing disability, which made it difficult taking instructions when her hearing aid needed charging, and I was unfocused that I needed to charge the hearing aid. The next thing is I could not change her diaper when her arthritis was cutting up, and she was tired of taking capsules. She was in a lot of pain, and she just laid there with bed sores starting to open up in her last days. I was able to heal some of the bed sores with Desitin and covering with bandages and silver alginate dressing. It got to the point where she would not take anything, not even the liquid Tylenol I purchased for her. She would not accept any solid food later, as when she was, I was spoon feeding her, and then later, only liquid. My mother died on my birthday, November 27, 2023. She went into the hospital on April 6, 2023, was released, and from that point on at home, I cared for her until she passed on. To wind this up, the procedure, which is called endoscopic retrograde cholangiopancreatography and performed on my mother, is a higher risk procedure than for other methods prescribed for the same thing. Some professional authors just describe it as a high-risk procedure. It additionally is a higher risk, I understand, for females and for the elderly, depending on their preoperative condition. Two of the medicines that she was prescribed was losartan and amlodipine. These both can cause liver complications and jaundice. After she was hastily released from the hospital, Our facility at the house was what could be provided in a small bedroom that a wheelchair could not fit or maneuver. The next thing is, I had joy in my heart serving my mother. However, the task was grueling. There were times I felt I was going to fall out, and I wondered if I would get through and survive myself. Getting back to the major hospital in Baltimore, Maryland that was entrusted and, in my opinion, failed was not an option. At the end of caring for my mother for 7 months, I experienced a devastation in both mind and body, which no one can understand unless they performed it. I myself need treatment. This procedure possibly has assisted many people to survive, but if one does not understand or is unaware of the adverse reactions, it can mean handing your loved one their own death certificate. As a side note, I received a disturbing message from the grave of my mother, saying that her eye parts had been stolen without authorization and given to someone, a man. This is to say, make sure you have a reputable funeral home to serve you. This is Sheryl Fisher, president of Araxis 3 Productions, representing my talk on gallbladder stent operations. Thank you.